I think we'll probably wait a couple of more minutes to give folks an opportunity to log in, particularly those who were going to come on through Zoom. So we'll start at, I think, exactly 7:05. We'll just give people a few minutes, and if you're on Facebook, we will be starting in about 5 minutes. We're all here, but we want to make sure that everybody has an opportunity to get on as we begin the show. So thank you so much for being with us, and very excited about this conversation. Give folks an opportunity. If you're just joining us, we'll be starting at exactly 7:05. 7:05. Thank you for being on. We want to give folks an opportunity to log in, and we will start at 7:05. We want to give folks. Well, I think we're ready to go now. It is at least on my clock, it is 7:05. Good evening, everyone. It is a wonderful, wonderful pleasure for me to be here. Non pas moi, c'est Johnny Celestin et moi New York. Et tonight we're going to be having an amazing conversation with a group of friends who are here to talk about the Haitian policy agenda that has been developed over a number of months now. I'm going to start by just kind of giving some introductory words and Once we're done with that, we are going to move on to ask, Santra to give us a broader understanding of the purpose that was behind developing this policy agenda. Then we will have Leonie, who will talk to us a little bit about how we got to where we are today. And then we will have a couple of other colleagues who will then talk about the components that are in the agenda itself. Once we've talked about that, then we will then go into Q&A, and that will be an opportunity for you to ask questions and to engage. We really want to hear from you. This is not just a group of folks who are going to sort of just tell you about what's been developed, but it's an opportunity for them to hear from you and get a reaction from what you've heard. Then we will get not a closing, but a call to action by Dr. Gerda, and then we will close. I wanted to make sure that we all understood sort of the process that we're going to go through and the opportunities that everybody will have to sort of hear about the key components of this agenda, and the opportunities that we will all have to participate in a conversation. So I will try to navigate that conversation together with you, moderate it, and I can be a tough moderator at some point, and I know that sometimes the questions can become statements. So I'll tell you up front that you will forgive me if I jump in and tell you to ask a question, because or if you're going to make a reflection, to sort of say it's a reflection, but to be very pointed about that reflection. The few words that I really wanted to say is that, as in terms of background, in terms of the situational analysis, we all know that Haitians started immigrating in large number, really for a number of years, and this has been for many, many reasons over time. What it has resulted into is a Haitian diaspora community that is about 1 million strong, and that is in a number of states here in America. Primarily, the largest group of Haitians are in Florida. The next largest group is in New York, then Massachusetts, New Jersey, and Pennsylvania. Then we have our friends in Georgia, Connecticut, Maryland, Illinois, and California. But I know there's Haitians all over the United States. And when we talk about these numbers, we're talking about the official numbers, primarily some numbers that came out of America's Community Survey, but we know that with the most recent one that was done, we will be getting more up-to-date numbers. I say all this to say that we are a vibrant diaspora community. We are a community of folks that are hardworking, very often considered high achievers. And many places that you go, many large international companies, in government, in private sector, wherever you go, you will find Haitian and Haitian Americans at very, very high level who are having great success. And so our community is a community that has a lot of assets. It has both intellectual assets, it has financial assets, but most importantly, it has people, right? Because at the end of the day, all of those things, for them to actually make a difference, it is really about who are the people, and it is us as Haitian Americans who are the ones who make this community what it is, who make this community thrive. We also very often talk about the fact that as a community that is here in the United States, there is a component of our lives that is in some ways connected to home, meaning connected to Haiti. And very often we talk about our community's contribution to our motherland, to Haiti. And that is quite often talked about in terms of the remittances that are sent. And obviously the most recent numbers from 2019 and 2020 respectively have shown the Haitian diaspora transferring about $3.5 billion in 2019 to about $3.8 billion in 2020. So right in the midst of this pandemic that we are experiencing, the Haitian community continued to serve as a pillar for our community back home. And that contribution is about 36% of the country's GDP. So that's really a very important asset, again, that we have in this community that is working both here in America, but also supporting the economy in Haiti. So today the world is more globalized, interconnected, interdependent, and it is so more than ever before. And despite the economic crisis, we understand that as a people, as a community, we're not an island. We cannot operate alone without sort of considering the connections that we have as Haitian Americans who are here. And that really is what brought us here tonight. This vision, this project that you have in front of you today really is a result of partnership between a number of people and organization. And I think it really illustrates what can be achieved when a community comes together, when the community talks to each other respectfully, and sometimes there are disagreement, but the final objective is that there is a spirit of collaboration because there is a common objective, which is what is good for our community here in the United States. So this collaboration in this has allowed this group to create, really to build momentum and trust. And that momentum is trust has resulted in this agenda that we have. And it's a very specific, when we talk about agenda, we talk about a policy agenda. We'll be talking about the reason why a policy agenda. We'll be talking about what is a policy agenda, but it is important to understand that this group of folks, after a lot of work, a lot of labor, a lot of love, a lot of conversations, have and conversation across the board with organizations and individual, have developed something, have created something that is a reflection of those conversations, those very broad conversation, primarily that took place in South Florida. Although as a New Yorker, I was very fortunate to be part of that conversation. So I will stop here with my opening. I wanted to give that context because I think it's important for us to understand what took place, even though we'll go into some of the details. And so that would allow us to better understand, this conversation that we're going to have. So what I'm going to start with, the Sandra. In Sandra, I'm going to start with a question for you. Really, tell us about the purpose of this town hall from your perspective, and more importantly, what is a policy agenda?
Absolutely. Thank you all so much for joining us this evening. I would be remiss if I didn't start off by saying Happy Haitian Heritage Month for folks. We thought it to be right for the community to come together to not only celebrate our heritage, but to think about this generation, the decade that's coming up, and where we want to be in 2030. We would also be remiss if we didn't acknowledge, and I'm going to tip my hat to my fellow panelists, the memory of George Floyd, a fellow Black man in America who, on this anniversary, we are talking about a Black community in America, and the opportunity for our community to thrive and to ensure that our community members have all the resources that it needs, so that we can take care of ourselves and our families and the generations to come as well. And so definitely wanted to name that. And we know that real change happens in this country through policy. And so what is a policy and agenda? A policy agenda is directives to elected officials who we elect and who with our tax dollars make decisions on what they will prioritize for our cities, for our counties, for our state, and for our federal government. And so we thought it to be fair for organizations to come together. I would definitely want to lift up Santla, who's been doing a community agenda conference for years. And this year, specifically in 2020, excuse me, we definitely wanted to think about 2020 being a pivotal year where there was a census, where there was a presidential election that we were watching really closely, that we wanted to have a policy agenda from our community, for our community, to let elected officials know that we're not only, we're not the same community that came decades ago, where we only are trying to get our basic needs met. We also want an opportunity to thrive. And so that's what the policy agenda is. Many components of it are, as we are multifaceted people, we care about many things. We're business owners, we are students, we have, we buy homes in this country. We care about whether or not our money is going to last until we retire. And so all those things come up in the policy agenda. And again, when we think about policies, we know that if there isn't a policy, many times there's not resources for the things that we want to move forward in our communities to move forward. And I'll pause there.
Thank you so much. Thank you so much, Central. I think it's important what you just highlighted, because folks may question, you know, why does someone have to spend all this time to develop a policy agenda? And I think it's important to frame that point to sort of help us understand that as folks who live here, right, who invest our lives and who are participating in this economy, we need to have a say. But je nous dis en créole, puis c'est gars et pas qui met. Donc, we need to find a way, right, to sort of say, here are the things that we really are thinking about and that are important for us as a community, and make sure that this can be handed over to our elected official, right? And so that they understand what our priorities are. I really appreciated that. And thank you so much for that. I don't know if you want to add.
I want to just add one more thing. You know, Haitian people are very serious about our money, right? I grew up in a household where my mom knew where every dollar went. And oftentimes we just pay taxes, sales tax, when we have to pay taxes that comes directly out of our checks. We don't really sit down and think about how do we want that money to be spent really, right? And so the policy agenda is telling our elected officials, here are our priorities. Those tax dollars, this is what our community want to prioritize. And I think it's really important because we're not talking about a little bit of money. For folks like us, young people, no children, may not have purchased homes, they are taking a lot of taxes out of our checks, right? And so it's important that we say, here's where we want our money to go. We can't play about our money. We got to be serious, and we got to say, our community is a serious community. We're a thriving community. And we want to make sure that you all know that you're not guessing, you're not thinking about what is best for our community, that our communities have a say-so in that. And we have a say-so in what our money is going, and that impact that we want it to have on our community.
Great, great. Thank you. Thank you so much. I'm going to come back.
Dr. Gerda, are you coming in? I'm sorry, Johnny.
It's all right. Anybody else want to make a comment on the policy agenda component?
The only piece I was going to add from what Santa just added, and that is, this is also about setting precedents for the next generation, right? We are a young generation also here, as well as in Haiti. This is a chance for them to also see that what their future could look like. That if in fact we are able to take a look and create policy agendas today, that means those who are turning 18, those who are turning 16, those who are paying attention on, you know, all of our social media, recognize that that is what we do. You know, nous c'est quoi nous, you know, for Haitian Heritage Month, dans ce compas, but we also set agenda. We talk about agenda as well, which is really important. So I just wanted to add the importance of the future generation and what that means for them as well.
Thank you, Dr. G. And if I could say it in another word as well, you need a plan, right? You need a plan. Si vous prenez côté, ou pas qu'à juste lever ou aller. Donc, si communauté en décide de côté le vle aller, faut qu'il y ait un plan de qui ça le vle. Faut le discuter qui côté nous aller en vacances année ça? Est-ce que nous pral Haïti? Est-ce que nous pral Bahamas? Est-ce que faut que nous décider? Et koulian, l'un fin décider qui côté nous aller, nous avons commencé à regarder qui j'en pral aller là, qui ça n'a besoin? On a besoin de bateau, on a besoin de machine, qui ça n'a besoin? So it's important. And I also wanted to kind of highlight sort of the other communities around us, because sometimes it's important to kind of, you know, compare and contrast, right? When folks sort of look at our Cuban-American community, our neighbors, right? We wonder, well, where does their power come from, right? Well, they've talked about what it is as a community they've wanted to achieve. And irrespective of where they fall politically, there are some things that are core to what they need as a community. And they sort of want to make sure that their elected officials reflect those views, right? So we talked a bit about what a policy agenda is, why it's important, but we didn't just land there, right? There was some work that was done to get us to where we are today. Leonie, I would love to, because you were the one who actually called me when I was in New York to say, come down. Johnny, we need you to come down. You're the one who invited me. You may have forgotten it, but
and then they stole you from me.
Help us paint for us, help us understand how we arrived to where we are today.
Well, thank
Give us the
you.
roadmap. How did we get here?
The roadmap, you know, I think it's pretty linear in a way, with some little zigs and zags, but pretty linear. I think that, you know, the genesis of this community was the genesis of a community struggling, an embattled community. When, you know, many of us came in South Florida, it was the quote unquote boat people who were denied the rights to be here, and, you know, the contrast in treatment by, you know, federal government between Haitians and Cubans was very blatant, and that sort of mobilized many communities, and primarily ours, to fight for our rights. So this type of mobilization occurred at the genesis of the community. As we progressed, you know, as we fought for immigration rights, and many battles were lost, and, you know, critical ones were won, it came to a point in 2000 when many in the community, led by now Commissioner Jean Monet's team, decided to have that a huge, it was around 1999, community conference, like a community agenda conference, when, you know, many folks came together. Johnny Macala was there from New York. There was still a Johnny present. And, you know, again, they began to create this roadmap as to what this community full of new citizens should be, particularly citizens who shared a geographic space, right? So you had little Haiti. Joe Celestin was talking about, Joe Celestin and Max Osinal were talking about, we're looking at the numbers, North Miami is it, guys. We're gonna, you know, this is ours to lose. You know, the numbers don't lie. They're third, you know, Joe Celestin was walking around with his, I still remember, with his document saying, you know, it's ours to win. So political, you know, the focus was very much on gaining political power, right? And so, you know, what followed, you know, this conference was, you know, the emergence of these elected officials, right? So it went from, you know, immigrants who didn't have any papers to fighting for residency, naturalized citizens, and then political power. So a lot of that emphasis was on that. So that was our first community agenda meeting. It took place in Miami, convened over 100 people who were focused on, you know, social, on programmatic issues, you know, action driven, you know, what is lacking in this community? What are the gaps that need to be filled? How do we as a community address these gaps? In 2000, I don't remember when, there was another conference. There was another community agenda conference, which took place. This time, Satla Haitian Neighborhood Center took the lead. It was 2014. And Satla took the lead and again convened a broad cross-section of stakeholders, leaders. At that time, they were elected officials. And again, we talked about what were the issues that were preventing our community from prospering, education issues, youth crime issues, economic empowerment. And so we discussed all of those subjects. And out of that conference, I think that something like the Satla Fellows, the Young Professional Leadership Program emerged because that was certainly something that the community was saying, we don't have next. What is our next in terms of a community leadership? And so, so in 2014, Satla took the lead in convening this Haitian Community Agenda Conference. And then in 2020, understanding that we were entering this, very complex phase in our lives as a community. There was such a confluence of issues, whether it was the census, whether it was the political climate, the anti-immigrant climate, the elections. We were compelled again in November to come together, in February, to come together. And I have, if you can see it, to come together as the Haitian Community Agenda Conference, Nula Pile. And that was another great event. And this time, which was different from the past prior two conferences, we had a focus on Haiti. We had an eye on Haiti, and that's where we invited participants from Haiti, so that, because as a diaspora, Haiti was, as members of the Haitian nation, we were always asked to give an opinion about Haiti. We're always asked to have a position about Haiti. And so it was important to us that we bring young people who were part of movements in Haiti, leaders, to talk about, sort of update us, to let us know. And that's where you also participated, to sort of give us an insight as to what Haiti was. And, out of that conference, again, particularly in terms of the elections, we continued to meet. And one of the questions that we were always asked, what's your, do you have an agenda? Do you have an agenda? What's your position? Can you give us a document? Can you present us with a document that sort of encapsulates your position as Haitian Americans, And so it was, something that we hadn't done. And because we have one policy wonk in our midst, Ms. Sandra Denis, she was sort of voluntold the task of drafting this agenda. And I think that she did a superb job in putting together not just her views, because one of the things that I've noticed is that as I've sort of been a part of different groups, I see that policy papers are written by one person. I would say, well, who else contributed to this? And I sort of get this odd look like, I know it all, me, of course. And this agenda was one that was written, that was drafted, definitely with input from a diverse group of people. And I know that Sandra made it a point, particularly when it came to Haiti. Haiti was a very difficult, the US issues were pretty clear cut in terms of what we wanted, in terms of education, economic development, but Haiti was a much more difficult issue. And, Sandra made it a point to really make it balanced, right? Because if she had listened to me, it would have been a whole different document.
Yeah, we wouldn't be in this meeting today. We'd be in prison.
No, Sunshine really made it a point to seek out different opinions, to really get a sense of a balanced view as to what we want as a diaspora with regards to Haiti. And so, um, it was, again, all of it collective. It came out of a process where organizations worked together, organization trusted one another, organization understood that they did not have to agree, but they had to be respectful of each other and open about disagreements. Not, you don't need a third party to tell the person you disagree with, I disagree with you. And so that's the climate that really birthed this policy agenda. It was one, again, of collaboration across age group, intergenerational, gender, and so we're very proud of it, and we hope that people who look at it can take what they want, adjust, modify, but understand that it's a real reflection. When people say, Haïtien pas jamais fait rien, Haitians don't ever accomplish anything, Haitians don't know how to work together. This is clearly a model of collective impact, of organizations working together, listening to each other, validating each other's voices, and memorializing all of that with this document. So we're very proud. Thank you.
Thank you, Leonie. And I just want, I noted two points. And I appreciated the fact that you kind of gave us a real history, right, of things that have happened over the last, I don't know, 20 years, right? And so I think it's important because I think quite often we could come to a conversation thinking that bagay lan tout calé, comme si son loi est calé qui juste c'est première fois le fait ou bien que c'est premier moun k'ap fè li. And I appreciated the fact that you really showed that there were, a lot of work that took place, and the work that those folks did are to be lauded, as well as saying we built from there, right? Mm-hmm. It didn't just happen and gets thrown away, and I appreciated that because I think, for those of us, and I didn't know that history, by the way, and so that was a lesson for me because I think it's important. Sometimes when you are in the middle of the battle, you tend to think that you either are alone or you're the first one doing it, and it's good to sort of understand that there is this legacy that you are actually standing on. You just didn't realize it, right? So I appreciated that. The second thing is, I kind of heard you made the distinction between sort of, the specific programmatic things that we wanted to get done, right? But that this is not about sort of the programmatic things that we want to get done, right? I mean, I've worked both in the private sector and in public sector, and I think quite often people don't realize that you can have a great program, but if it doesn't fit, right? Like if it doesn't fit, you must have quit. If it doesn't fit, right, within a real policy strategy, then the program itself may not be bad, right? But it just doesn't fit within a larger context. So you have to put that larger context in place. Could you talk a little bit about that in terms of the differentiation that you see between sort of the sort of the programmatic needs or the programmatic things that a community can and should work on, but then this sort of policy that needs to be put in place? So maybe it's not up, right? The policy is really like the frame.
Well, I think that the marriage between the two really makes one richer, makes either one much richer, right? Because we've had agenda conferences where people have come and thrown everything against the wall, right? Without any real understanding of what it takes to build a new school, what it takes to create jobs, what it takes to build roads, what the process is, who who the actors should be. You know, who do you have to have? You know, you have to have the state, the county, the federal government. So people, and that's one of the struggles that we've had in having those conferences, is the idea that creating these spaces raise expectations almost that you can do anything, right? As long as you come and you dream it, you know, I mean, I went not to this one, but I went to another conference where people were saying, let's build factories in Little Haiti, right? Not understanding that it's not a possibility. So having this marriage of policy and program and have one understand and inform the other will make for, you know, I can tell you, a much more richer and much more productive Haitian Community Agenda #4, right? Because we're definitely going to have more. And we know that having the interface between the policy, the roadmap, the plan, the understanding of who the actors are, what the vision is, will definitely make the conversation about programs much more productive and much richer.
Thank you. Ludmila, I want to bring you in this conversation because I know that this is something that you're quite passionate about. Mm-hmm. I'd like for you to talk a little bit about what I'm hearing in what Leonie is saying is system change, right? Sort of the redesign that needs to take place and the role of policy and the role of government in that sort of redesign, right? Sort of the government level of system design and the system itself. Could you sort of talk to us a little bit about that? What are your perspective in that frame of we need to be thinking about system change and what that is?
Excellent question. So my first thought to kind of add to what Leonie said is the scope of work of community-based organizations and the scope of work of government. They're intertwined, but very different. And so when we're talking about government and their role and public policy and building institutions, especially public institutions that serve people, whether it's social services or healthcare reform and health policy that allows us to access quality healthcare, the regulatory and policy that the government supports is able to be a barrier for us, or it's able to help us be kind of a little bit of an impetus to help us thrive. And so if we're thinking about a system like a house, you use the foundation analogy or the framework analogy. If we're thinking of a system as a house, policy can kind of act as the foundation that kind of insulates some of the foundation of the house and really making it more sturdy. Is the bathroom, does it have a toilet? Does it have a sink? Does it have a tub? We can think of policy in terms of, do we have the appropriate legislators? Do we have the appropriate, basically, general contractor who's going to come in and kind of help manage this work, and having a legislature who understands, well, people need X, Y, and Z in order to thrive, and really being able to implement that in policy so that we can build these public institutions that are going to serve us.
I want to give a quick example too, Johnny, if possible. One of the examples, both Lumila and I study public health, and we want our families to live long. We want them to have access to healthcare. In Florida, Medicaid expansion is still not the case. We could want more healthcare all we want. There's no funding for more healthcare if there isn't a policy that passes for Medicaid to be expanded. And Medicaid expanded, that doesn't mean everyone, doesn't mean if you have Medicaid, you'll get more Medicaid. It's people who don't have access to healthcare will then have an opportunity to have a public benefit. And so, yeah, we want more healthcare. Yeah, we want our families to go to the doctor more. We want them to have access to better quality healthcare so that they can live longer, so they don't have these, these comorbidities that make them, in this COVID case, more likely to pass away. But we actually need a policy in place that says to our government, we prioritize healthcare. It's important to us. We're willing to put our money behind healthcare. And this is what the policy agenda is trying to land. And that is the difference. The difference is that a community agenda, we can say, yeah, we want more healthcare, but a policy agenda will tell us and tell elected officials, hey, you want the Haitian community support. When you go to Tallahassee, when you sit on the dais, you need to be mindful of these things.
So if I'm hearing you right, if I'm understanding you right, when we are thinking as a community, these are the things that are important for us. It is not necessarily, although it's part of it, it is not necessarily the day that we see our elected official and we say we want X, right? It's actually, there are some processes that happen before that, right? And sometimes, if I'm hearing you, if I'm understanding you correctly, there could be an elected official who want to do something, but there isn't the policy framework to do it because there isn't even the funding and there isn't even the thought about it. Conversely, sometimes we are experiencing some things. They're not what we're experiencing today, have been in the works for a number of years. And so we're just sort of seeing the fruit of that work. But we haven't seen sort of the policies that were created to actually make that happen. Dr. G, I'd love, I know I see you shake your head, and I'd love to get your perspective if you could add something on the sort of the elected official component, right? I think Sandra talked about, we need to make ask to our elected official. How does having an agenda, right, a policy agenda, inform our decision, our choices in terms of, okay, we have these three people here as options for a particular elected office. How do I make a choice, right? Can an agenda help the community, help us think about who are the right people who are most prepared or ready or more focused on these issues because they are aligned with this agenda? How would you help me with that?
So yeah, absolutely, right? So the answer is yes, 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 right? So I think it is important, and one of the things that I think we sort of jokingly say oftentimes, I guess at least among our circles, that we can't vote whether or not the person bought your turkey, like this way, like that is not the reason for making sure that we're saying, yes, I'm voting for X person. We could have gone and got a turkey if we had policy that allow you to make more money, so you didn't need somebody to actually bring you a turkey. So here's the exciting thing for me about what a policy agenda does, because it allows you as an individual, when you are talking to the potential person who's saying, yes, I'm running to represent you in this district, as a county, in your state as your governor or your senator and so forth. Now you have a document to say, here are the points. It's not just mine, because it represents a whole community that says health is important, economic is important, education is important. Then you can ask the question, where are you? Where are your priorities in terms of your agenda, your own push? What will you be pushing for? Now you're listening with a piece of document in hand that said, oh, this person is about to go in and this is what they're saying that they want to do. Is that in my best interest, right, within the larger community? Sometimes we say all the time, are we voting in our own best interest? And sometimes we may be voting against our very own interests because we don't know what those interests are. So by virtue of having the policy piece, allows you to make sure that you are voting within that. The second thing that I think is really, for me, is really crucial is an issue about accountability. So now I have a scorecard. So here's my scorecard. So now we voted you in because you said these things were important for you and so forth. So now I'm paying attention to how are you voting? How are you, when these bills are showing up, how did you vote in the following areas? So when you show back up to say, vote for me to send me back, we can say, well, no, let's take a look at how you voted on these priorities that we said were important to us. And if you didn't support the initiative that would actually move this community forward, we saw we can't vote you back in. So the piece of an accountability becomes really important. And it's not one that I'm saying gather alone. I'm saying I'm asking for accountability for a larger community. And that matters quite a bit.
Wow. Yeah. So you ran on the platform of healthcare, and you never introduced a bill on healthcare, and you never voted.
You voted against it.
You voted against it. That's
and then you came with postcards and the t-shirts and something, right, to say, please vote for us.
That's for folks who just joined us, I just want to very quickly tell you sort of the process that we're going through here. Obviously, I did a little bit of an opening at the top of the of this conversation. Sandra gave us sort of the perspective on, what is the purpose of having a policy agenda. Then Leonie walked us through, sort of the timeline, right? And the historical timeline, which actually was quite longer than I actually even thought, in terms of how we got here. And now we are going to enter into the meat and potatoes of the policy agenda. And I've picked a few that I thought were relatively interesting, I think, for our community. And I'll tell them to you up front so you could start thinking about those points that I'm going to highlight for you. I think people would probably be very interested on the agenda to be talking about immigration, right? I mean, it's so apropos. How could I not talk about immigration? But I don't want to just talk about TPS today. I want to talk about sort of, this policy agenda, but from the perspective of what does it mean for our community when we say immigration, right? And what does it mean within this policy agenda? I think we should say something about health, because there is nothing if there's no health, right? I mean, if you're not healthy, you can't work, you can't take care of your family, you can't go to school, you can't worry about immigration because you're unhealthy. So I think that's extremely important. The third component, I think, is going to be about the moolah, right? Economic development. I mean, at the end of the day, you got to talk about the moolah. If you don't talk about the moolah, you're not talking about anything, right? So, so I think those three are issues that I think would be very important. That said, we have a pretty good chunk of time to have a conversation about this. So feel free, if there is something that is really important to you that you'd like to engage on, we can talk about those as well. But I just wanted to put it out there that we'll be mentioning those. So why don't we start with immigration, right? I mean, we just had President Biden, well, not the president himself, but his secretary at DHS, they've actually just given TPS to the Haitians here in the United States for 18 months. And I don't know who's going to take this on. Who will take immigration for me? I'll throw it out there. But when we're talking about immigration from a policy perspective, what are some of the two or three things that you might want to highlight in the agenda that you think as a community, not you think because you've had a long conversation about it, that has sort of risen to the top for our community to be thinking about in the long term in the policy agenda arena as it relates to immigration?
I can take a stab, and then I'll definitely want to pass it. Haven't heard from Gilbert yet, so
yes.
From my day work, we knew that it was important for there to be some type of redesignation. We want a pathway to citizenship, just to be frank. But we know that when people have mixed status, when they're undocumented in this country, specifically from a worker's perspective, they're exploited, right? They experience wage theft. And we're talking about our people, home health aides, nannies, people who are working in restaurants. They are treated horribly. And we know that when they have legal protections, when they have some type of legal status, such as TPS, while not the best, while not a permanent solution, it really allows for them to really come out of the shadows. And so Biden came to Little Haiti and he made promises. And I also want to tip my hat off to advocates in the Haitian community, but also our allies who pressed him. It was a full court press on many calls, asking him to to what did Marlene say? Promesse debt. I never heard that one before. But asking them to pay their debt to the Haitian community, because overwhelmingly there was a lot of folks who did a lot of work during the electoral cycle to make sure that they voted in their best interest, whether it be whatever they voted for. But it was tireless work, and then we were getting embarrassed. And so again, we're like, here's what we said we wanted from a policy perspective, and we're so thankful. And also, there's still more work to do in terms of immigration. So that definitely was on up top of the agenda to redesignate TPS, but there's so much more around citizenship and much more. And I'll pass to whoever else wants to.
Gilbert, I don't know if you want to take a stab at it as well. And I just want to let the audience know that we do have time that we'll open up for Q&A. So please, you could either type some of your questions now as you think about them, or write them on a notepad so to not forget them. But we will make space for a conversation where we will have a opportunity for you to participate. So, Gilbert?
So thank you, Johnny. Bonsoir tout le monde. Good evening, everyone. As Sandra mentioned, and Johnny at the introduction alluded to, we are very much an immigrant community, despite the fact that we are now 4 going on 5 generations here in the United States, from baby boomers to Generation Z. And the oldest of Generation Z now is starting to have children, right? So we're talking 5 generations plus. The big announcement about TPS redesignation reminds us again that a significant part of our makeup is that we originally, ancestrally speaking, come from Haiti. And so with that said, you have folks who are giving significantly back to the island through their remittances and through other means. And so our connection still back to the island is reflected in things such as our remittances and whatnot. So when you're talking numbers about now it's 100,000 or more who will be qualifying for just getting TPS new for them, right? Meaning that there were some 50,000 before who had it, and now it's going to be renewed for them. But there's another 100,000 that didn't have it, right, at all. So they were undocumented, they needed papers. And so with this redesignation, they now have some comfort in being able to stabilize their lives even furthermore here, to not just support their families that they have here, but also the families back on the island, which are very much in need. And so with that, TPS obviously was a very big deal. We have any number of other deportation-related cases in which we're still very much advocating to have that cease and desist for the time being, given the situations on the ground in Haiti. And so the advocacy very much still needs to continue. We are Americans as Haitian-Americans, but nonetheless, we're still thinking about Haiti. And so immigration still plays a significant role in that. And so pathway to citizenship, permanent residency, steps to get to that. Redesignating TPS again, another 18 months from now, right? If and when that comes up again. All of these things we need to keep in mind. But at the same time, think about our lives domestically here in the United States, how we can improve it for the next decade or so, with the new decade that we're living in right now.
Yep. So what you just laid out for us is really, when we talk about a policy, there are folks who may be saying, we got TPS, right? Okay. Maybe for some folks, that's what they were looking for. But the policy agenda is much broader than that. And in fact, it lays out a roadmap that is not purely about TPS. As a matter of fact, it goes much further, right? That's what I'm hearing from you. Leonie, you wanted to add something.
Yeah, I think I'm going in your direction. I think that immigration agenda is also about a Haiti agenda, because we know that TPS was granted not because we were clamoring about it here. TPS has been granted to Haitians when things have been dire in Haiti, whether it's the earthquake or whether it's the current conditions on, the crimes, the violence, the kidnapping. So there is always an intersection between what the U.S.'s policies in Haiti are and how immigration, what are the immigration patterns? Because again, people make the decision to leave their country, sell property, and all of that good stuff because, as we were saying, folks stop projecting themselves into their country's future. People don't feel safe. People feel that things are deteriorating. So immigration is more than, you know, TPS, etc. It's about more.
So I'm hearing root causes, right? I'm hearing that immigration is sort of it's the result, right? It's the output, right? But we really need to be thinking about what went in, right? I think everybody understands that most people would like to stay back in Haiti, would like to stay home where it's warm, même si geti mayen. Bon, hopefully would have electricity 24 sur 24 pour mes sedet. But yeah, but I'm hearing root causes. Anybody else has something they want to add on immigration, Dr. G? Yes.
So thank you. I'm so glad you brought up the point about the causes, because oftentimes when I hear people talk about migration, we talk about it being a financial piece. So there's larger issues, right, as to why somebody, we know very well, as Leonie just said, people don't want to leave their home. People are not looking to leave under the Piedmont go, you know, and it's not just for us, but others as well who are coming into this country. People are not looking to leave their home. They are forced to leave their home. So we have to take a look at what are the conditions at home that are man-made, that are also man-made, that does not allow one to be in their country for us to be, you know, celebrating this small victory, because it's a small victory that we have with this TPS. The other piece that I was going to mention, Johnny, which I think is important, there's also the in terms of when you're looking at this piece around immigration, is what happens to people once they come here, once they get here. So we have to pay attention to what is that process? What is that treatment? What does that look like? What does that look like for Haitians that's different for other immigrant groups that are coming here? We know very well here in Florida, it is not an equal process at all. You know, so when we're looking at the detention process, the detention centers and what all of that looks like, it's a part of that whole immigration piece as well, and the policy as well. And which is why, for me, it's important to pay attention to not just what's coming, what's here, but also what's, you know, what really is happening in the country as well. So just wanted to add the piece around the treatment that we oftentimes see that our brothers and sisters receive when they do get here.
Absolutely.
And if I may add one thing, and I think that maybe we missed that perhaps, I'm not sure, but it's the gender lens. I think that what happens to women when they migrate here, women who have children, women who are vulnerable, I think that that's another thing that, you know, we must also look at in the context of migration.
One more.
Let me ask a question now. At what point will we stop being an immigration community? Because for 50 years,
Dan,
yes,
if you don't mind, Dan,
we need to stop to be a community.
Dan, thank you. I appreciate it. We are going to make time, but I really appreciate that. Very kind of you. I was going to switch over to, and I was going to make a point that, and as Dan said this, I was going to say to folks that don't forget to download the Haitian-American policy agenda document. Read it, and I think, you know, there'll be an opportunity for you to react to it and add to it, because I think it's important. And I probably was remiss in not saying this. You know, obviously, this is something that was created within the South Florida community, but I think the idea is to have this be a tool that can be, you know, shared, obviously, with Haitian American communities all across the United States. And I think the more people sort of read it and look at it, they can enrich it and make it sort of, you know, a real larger agenda document. I wanted to switch over to health, and I know that.
Misbehave and add just one thing. I'm so sorry, Johnny.
Go ahead, Sandra.
2 seconds. Dr. G just really got me riled up, because I think historically there has been racism against Black immigrants in this country. And so a lot of times we compare ourselves to other groups when we know we are racially profiled as immigrants. If they're going to do any detaining, it's going to be us who's going to be detained. So that's in the policy agenda. The other thing we want to talk about is the economics that is related to immigration as well. And so under the Trump administration, fees skyrocket for citizenship. And so we're asking the administrations and any folks who have powers over these systems to don't make it hard for people to be citizens, right? That if the fees, specifically for TPS as well, that whether or not they can consider the case of folks who've gone through this pandemic, who've lost their jobs, right? Who are still trying to make up. And so those are also requests that we're making for and by our communities to elected officials at every level as well. And I'll pause.
Yeah. And folks may not notice, there are policy choices like the Trump administration made, for example, family reunification, where folks had to actually, it's at the decision of DHS to actually invite you to come, right, for your interview. And what they do is they basically kind of take people, you're on a wait list, right? And they take the oldest one first, and then they keep adding to the list. Well, the Trump administration, what they did was they basically stopped adding people to the list, right? Added no more. So which means that they completed the backfill, the folks who were there 3, 4, 5 years, and then the list was empty, right? So there are policy choices that's made sometimes that we're not aware of that has an effect on families being together. So I'll switch over to, and again, we will have an opportunity for Q&As and to have a conversation on this. I wanted to switch over to healthcare. Obviously, we are still living, right, with COVID. At least, things are getting better here in the United States. But back in Haiti, we're hearing of COVID, unfortunately, even the folks that I used to work with at Clay, today, the entire team had to go out and get tested because they started feeling ill because they were traveling. And so, it's happening. And it really was something that affected our community. Ludmila, I'm going to come to you. Obviously, it's going to be you and Santra that I'm going to go to first as folks who studied this field. Can you talk a little bit about the impact of COVID on our community, particularly the South Florida community, and the sort of the challenges, the root causes that were behind what our community experienced?
Mm-hmm. So I'd say the biggest kind of aha moment during COVID is really showing something that Sandra and I probably know intimately, is that there are so many flaws in the US healthcare system. Access to care is a problem, just the infrastructure and the policies that support how people are able to pay for their care. And so COVID really highlighted so many of the places that the system just does not work, how clinics are set up and are able to intake patients, how even just community-based clinics are at capacity when it comes to testing and vaccination, and really that the system, we need system redesign, going back to my initial thought. So when it comes to COVID, and not even getting into what happened in the pandemic specifically and infection rates and testing rates, but people who are uninsured, who are getting COVID, if they're hospitalized, what happens to them? What is the safety net where people are able to get care in the event that they have a severe illness? There's not really that foundation and that infrastructure to really support people in that way in the United States. And so when we're thinking about our Haitian-American community and really looking at it from social determinants of health and looking at how our personal characteristics are influence our health outcomes, healthcare is not always delivered in a culturally competent way. It's not always translated en Creole. Sometimes there's a little bit of a cultural gap and a health literacy gap. And not only do we need systems and clinics and policies and clinicians who are able to address that, we need people to support people in being able to afford it. And how do we really support people in caring for themselves? And big picture, when there is a public health emergency, what does that infrastructure look like? who's able to get access to vaccines if they would like them, who's able to get access to testing. How are we going to contain an infectious disease if we're not screening at the rates that we should? And we know that our community, a lot of people might be frontline workers working in the service industry. And I'm going to tie it back to immigration, might not have all of the documentation in order to make a doctor's appointment for that testing. So all of this is interconnected. And when we think about access to care, some things that we have in the policy agenda are really having health programs that are culturally competent and having translations, putting clinics and health services in communities, our communities and Haitian-American communities. So our parents, our cousins, our aunts and uncles are able to access. And thinking more broadly, in 2022, Medicaid expansion is supposed to be on the Florida ballot. So as we kind of think about these bigger systems problems and realizing top down, COVID really just showed us so many of the things that are not working well in healthcare.
Sandra, we know that if you are young, healthy, if you are wealthy, COVID had less of an impact to you. If you live in certain communities, and as a matter of fact, we can do a COVID redlining, right? We can literally, I think, go through a redline our communities to figure out where COVID has the most impact. But there are some, maybe what we would talk about underlying condition. Can you talk about what some of those things are and what response, if you could tie it again to the policy agenda that we're thinking about in terms of saying these are the underlying condition and these are the policies we have to have in place so that we ensure, right, that our community receives the care it needs in order to be healthy. Can you talk about that? And then anybody else who wants to afterwards can jump in from the panel.
Yeah, thank you for that question, Johnny. And we're almost at the time where folks can chime in and ask questions. For me, what's come up is, one, I am deeply saddened and worried about the mental health impact that the loss of so many of our community members. I go to a mega church. We've lost dozens. Some of our esteemed leaders have passed away and we haven't been able to properly grieve them. I think that's going to have a lasting impact on the health of our communities. The other thing I'll lift up in terms of comorbidities or pre-existings is chronic stress can kill you. And working class people experience chronic stress. And so when folks are like, I'm getting tension, all of these things also have a lot to do with the way that we work, where we work, the kinds of work that we do, where we live, the pollution that is there. And many of the folks who really got COVID were folks who were not able to socially distance. Many folks live in their homes. They work frontline workers. They live in apartment buildings, many people in and out. And so those are the folks who got impacted. And what we're saying is, in the wealthiest country in the world, this failure of a healthcare system should not have happened, right? And I would be remiss if I didn't connect it to schools, right? And so COVID not only impact, let's even talk about mental health in students right now as well. So the impact of our health, people getting sick, kids being home, kids getting sick as well, mental exhaustion of being home together in small spaces. It's been a lot for our communities, and we want folks who see our policy agenda, elected officials who get our policy agenda to understand that there's not a vibrant Haitian community if there's not health, if they do not pass some kind of universal health care for us, so that people who don't have access to jobs with health care, they need to have a pathway so that they can pay for their health care as well. And then last thing I'll say is, fundamentally, our healthcare system today is, if you have a job, your job will give you insurance. Hundreds of thousands of people lost their jobs during this pandemic. And because of that, they had no access to healthcare in the wealthiest country in the world. That shouldn't be. And I think we have a responsibility to push our elected officials, to push our government to make sure that all of us have access to healthcare. And if we do have access to healthcare, if we do have good paying jobs, we go to great schools, definitely some of the chronic diseases that we're having, I'm sure we don't have it. Listen, you know, they like to say Haitians don't eat well, Haitians eat well. You know, when we look in Haiti, you know, you're being sexy, they doing their thing. It's that's in the movie. I truly believe it. And so I think we really need to address that. And for sure, some of that stuff, some of those components you can find in the policy agenda.
I was
Go
only
ahead,
going to
Dr. G.
add 2 points to what Santa said, because li pale de sam d'apre stress là, m'dapre pale de li, so kon ya ma bo diplôme psychologie ou là, bien parler. You know, because I know it really is because we underestimate stress and we underestimate the impact and what it does to the body. Stress weakens your immune system, and when it weakens your immune system, it makes you vulnerable to a whole host of things. So you just laid it out. The one piece I would add to all of that is stress related to racism. Racial stress is real. Okay, so when we're here today remembering George Floyd today, we know that not just George Floyd, but all the other George Floyds in our community who were impacted, right, by brutality, by injustices, also has a toll to play as well. So we know we can't talk about it, and that's not just me. The World Health Organization says we can't talk about health without including mental health. And so we know it really is important for us to really have a much more comprehensive plan in terms of really addressing health in this country. And let me tell you, the stress that what we just experienced in the last year have told us that in fact, we do not have an infrastructure in place. And we know the next pandemic may be around the corner. And so the question is, what is it that we're building right now to ensure that that we are laying something for what to come in the future, right? And we didn't even talk about the rate of substance abuse that happened, right? More people were drinking during this time of time. We saw more domestic violence issues, right, happening. Intimate partner violence was happening. So the issues are dire, and it is important for us to really focus on health as a part of this agenda as well.
Dr. G, I this morning, as I was thinking about George Floyd, and I was thinking about sort of, you know, what I've been experiencing, and I'm extremely fortunate. You know, and yet I was thinking to myself, I wish I can just go somewhere and just leave this all behind, right? And then I realized, as a Black man, there's nowhere I can go where my skin is not like an issue, right? And so it was so disheartening, but at the same time, I said, well, that means I'm gonna fight, right? Because I have my daughter, I have my baby coming up, right? So like, so it in the one hand, I'm like, oh my God, like this is, I have nowhere to go. So that's it, right? But on the other hand, I'm like, okay, so that means men up, right? And so we got to do this. The other thing that,
oops, sorry, finish.
I'm sorry, go ahead. No,
No,
I was gonna segue to
okay,
economic
I
and
just want to
bring,
say in terms of health,
yeah,
again, stress the interconnectedness of issues.
yes,
Because when we talk about stress, when we talk about powerlessness, when we talk about all these things, we can't just get to that point. We have to talk about strategies of empowerment. We have to talk about grassroots, you know, efforts, educating our community that speaking for yourselves, speaking, you know, your truth is not, you know, c'est pas voyer compte, c'est pas voyer wash, c'est pas chercher mon compte, you know, it's not telling the elected official you're not doing your job. It is about that balance. It is about saying, you know, I don't have health care, I'm stressed, but I'm going to do things that are going to make me feel like I have some control. And so I think that again, there are issues that sort of go across the board, and this idea of neighborhood community empowerment and elevating our voices is as critical when we talk about healthcare and when we talk about other things.
Thank you. And the segue really is to the last point I wanted to.
Johnny, 10 seconds.
Oh, on health, because I was coming to you. Well,
okay.
you can take your 10 seconds because my next question was to you, right?
Okay.
Because I was going to, and you could still mention health to begin, but I wanted to segue to say a lot of the things that we talk about and a lot of the stress, part of it has to do, and Leonie just alluded to it, has to do also with the fact that when people do not have an income, when people do not have a steady job, when people have a job where they can make ends meet, right? Particularly through COVID, right? That adds to the stress. So I was going to pivot to you, Gilbert, to talk a little bit about sort of the impact, the economic impact in our community. And so you could link it to health. And I was going to also ask about sort of small businesses within the community as anchors, right? What does that mean? How have they been affected? So it's all yours now, Gilbert. Take your 30 seconds and more.
Thanks, Johnny. Yeah, great segue, right? So understand that it's a compliment, but it's said so often that it becomes ad nauseum. It does reflect the reality when you keep hearing people say that the Haitian people are a resilient people, right? We hear that consistently over and over again during the current crisis that we're seeing in Haiti, during the impact that COVID-19 has in our community, wherever we are in the world, in generally speaking, and just the history of what Haitians are, going back to the revolution and whatnot, right? The original Haitian revolution. That doesn't mean, yes, I'm resilient. Obviously, you have to be resilient for us to become integral members that we've become now in the American society, right? In our various communities that we live in. But that doesn't mean that we have to willingly subject ourselves to these various social determinant stressors, right? That have been discussed during the previous segment. And so within the policy agenda paper, what we're saying is that we have our individual nuances that need to be recognized, right? And so the approaches to us, there are some social competencies that you have to add to that. But in the end, it's not just to our own benefit as a Haitian-American community, but the broader community that we exist in. So it doesn't just help us, it helps everybody in and around. So segue into economic development and whatnot. We've made great strides, right? For majority of folks, when they came to this country, there was a language barrier, right? Amongst other detractions that they had. But nonetheless, we have generations now established here, and we see success across the board, right? Nonetheless, on average, we are a poorer community, right, than the general American community. Keep in mind, when folks are, our parents, grandparents, and whatnot landed on these shores, they didn't necessarily have an economic development package for them, like some other communities might have had in the past, right? We didn't necessarily were involved in World War II, but we didn't have something like a GI Bill or something like that, right? And geopolitics being what it is, there weren't various, economic incentives that were made available necessarily to get your foot placed right on the socioeconomic ladder to boost yourself. With that said, we're talking about now recovering from this pandemic. A number of folks in our community work service sector jobs that they lost as a result because there was no demand, right? And so now we're starting to reopen, right? We need to advocate for whatever particular trainings, programs that we need moving forward, okay? With this new 2020 decade, for instance, right? New skill sets, again, social competencies that are needed that come along with that. Leonie could delve a little bit more into that as far as what she's seeing for folks needing particular services in Sunlight, for instance, right? So that we can better be able to get our foot on the ladder, on the socioeconomic ladder. When it comes to small businesses and whatnot, we talk about these small business loans / grants, right, that were given to keep businesses afloat, right, during the year and a half that the country was shut down during COVID-19. But for many in our community, it seems as if that world of that kind of government assistance was a separate universe, right? For whatever reasons, folks didn't necessarily have access to those kinds of things. It's about time.
Well, I'll tell you some reasons because it happened in New York. I'll tell you.
Go ahead.
Some of the reasons is that a number of our folks, particularly those who had restaurants or small businesses, first of all, were not, they didn't have any. I was surprised folks didn't have a bank account, because the first thing that they ask you is the relationship with your banker, which puts you at a disadvantage.
And we're
The
now in
next
2020,
thing,
right? We're now in 2020. We're now in 2020, starting back in 2020, now 2020.
exactly,
We're
exactly.
still having these kinds of discussions about having a bank account. Simple fact.
Exactly. Then the next thing they ask you is, show me your payroll, right? Because you have to pay, you have to show, you said you had employees, right? So this is about PPE, what is it, PPE or PPP? I can't remember, but one of the two P's, whatever.
PPP, prison.
Right? And people didn't have a payroll to show. Then they said, well, you said you're losing money. Show me your books. Well, guess what? People didn't have an account, right? So those are some of the reasons. And by the way, I don't know if it's the same in Florida, but I got to tell you, a lot of folks here in New York really suffered from those issues. But anyway, I'm sorry. I go ahead.
No, you basically highlighted some of the underlying reasons why it was such a separate universe, right? And in terms of what the Haitian American community had access to in terms of keeping their small businesses afloat, the doors were closed necessarily, but when things reopen back up, they can get to start running, right? As soon as things are allowed to operate the way that they can. Just for a significant number just are not going to be able to do that kind of a thing. And so that's a significant step back, right? It's basically as if you're rebuilding all over again, right? Due to the lost income that comes as a result. So again, that's something that I think us as a community, there is responsibility that we have to take towards that, right? At the same time, being the kind of community anchors that we are, generally speaking, right? If others are able to get attention when it comes to these types of things, we need to find the proper means and ways and advocate for getting that same attention to moving forward. So that's a discussion that we need to continue to have. Like I know with the Novice and some, we've been having that conversation for quite some time. And we need to be more honest as a community to do these kinds of things. We have chambers of commerce, which help with these kinds of things. But the advocacy with our elected officials also very much, we need to be in their ears more about the protest.
Thank you. I was going to start the Q&A at 8:20, but I think it's 8:21, and I appreciate everyone being patient with us. I try to time things in such a way, so I'm about a minute over, but I'm going to steal another minute to see if anyone had any other point. Oh, thank you, because I was going to ask, to sort of, go ahead, Sandra.
I'm going to be really quick. I think that also when we think about how communities such as ours have been able to build wealth in the country, it's really been through entrepreneurship and home ownership. And I know home ownership is complicated right now. There's another wave of foreclosures that might be coming up. But if we do not have thriving businesses in our communities, we are not a strong community, right? And so what are the policies that can be put in place that will allow for our communities to have more access to capital when they want to scale, understand how different sectors are changing, right? Miami is really talking about technology. Technology is coming. They want it to be a tech hub. What does that mean for our small businesses here? Will they be able to afford rent? So it's important for us to ask our elected officials to ensure that our business owners have the information that they need, have the resources that they need to continue to thrive in our communities, or else, who's going to hire us? We hire each other. Right? We're the ones, the small businesses are the underbelly of this economy in South Florida. So it's important that they thrive. A lot of them are not coming back. So I would like to see in the next 10 years, all businesses having an accountant, all businesses having payroll, right? That's something we can commit to. And I know Hakoff, who was a partner in this, is definitely up for the challenge to make sure that our businesses have what it needs, so that when these kind of programs and opportunities come about, they're ready to receive it, or else, y'all, the train will leave us behind. And there's some folks who will come up and make it and survive through this pandemic, while there are others in our communities who this has taken their family 10, 20 years behind.
Indeed.
I'll pause there.
Thank you. And again, if you have questions, I'm
Yeah,
going to go into the Q&A.
I just
I-
want to add something as well. I think that there's also, you know, education needs to be a critical point in terms of, you know, preparing the workforce, you know, speaking English. We really need to push our people to learn how to speak English. We need to create opportunities for our people to be more technologically savvy, and I'm talking about low tech savvy. But I also think that there are other strategies of wealth building that we don't recognize, right? The back and forth, the Pepe business with Haiti. Do you know how many women and families have paid, you know, for their children's education, paid for their homes through these back and forth businesses that no bank will recognize? There's very little recognition, and maybe they don't want it to be recognized either because, you know, they don't want to declare anything. But that is another strategy. I mean, when I go to Haiti and I sit next to women who have like these huge businesses in Haiti, and that helps support, you know, sometimes businesses here, and that needs to be, you know, we need to work with those folks because whether here or in Haiti, especially when poor, low-wage women engage in some activities, they're rarely recognized, right? If you go to any chamber, they will not recognize a farming, you know, peasant woman as a business person, right? It's just not recognized. And I think that sometimes we do the same thing with our Madame Sarah. There's no kind of recognition of their economic power in this community.
Thank you,
So
Leonie. Thank you. Thank you. Ludmila, I know you had a questions, but give me, or a comment, but please bear with me. I think, you know, the folks who are here have been waiting for a bit, and we took 5 minutes from them. So I'd love to give folks an opportunity to react. So folks, this is the opportunity for us to engage in a conversation. If you have a question, if you have a comment, please raise your hand and let's go.
where's Dan?
Oh, mas it didn't get endormi? No, didn't dormi.
Well, I'm here.
Oh, okay, okay.
I'm
then.
just very puzzled, like I see people of young age talking about immigration when they know nothing about immigration because they were born here. They didn't know about a descent, they didn't know about the good people. They're in the 30s, they're in the 50s. So I'm not saying that they have nothing to do with immigration. That's mean we're no longer a community of immigration. That's the reason why we have to fight for TPS. And in fact, we have many other things that are more important for us to fight for. But everybody was TPS, 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 TPS. That can be going on. I hope this is the last time this community will need to divorce. I say divorce with immigration. We cannot be forever. After 40 years, 50 years, we need to go to the promised land now. Meaning economic opportunities, we need to be richer. Understand there is a bleeding. There's a deep. The problem is much deeper than that because most of you, I'm glad that you guys come back to the community. We lost so many that identify today the African American. We don't have them anymore. That's a big problem. That's why we cannot grow. That's why we see about immigration. Or we just go to California, we go there, we just spread all over the place instead of coming back to the community. Like the Cubans, they are together, like the other ones. But please, we need to stop in an immigration community.
Thank you, Dan. I mean, I think your point is well taken in terms of, you know, where you think the priorities should be. I would say, and I think Dr. G raised, I don't know if you raised your hand, Dr. G, but I would say
the priority should be, for example, I'm looking at J.I. for example, that we have on 159. But guess what? I don't think one Haitian worked in that project. We need to have contractors. We need to have air conditioners. We need to be part of the system, an integral way of it. To be part. Because like I do, like if you go to a concert, you see all the Hispanics, the Cuban, they are there because I understand they have the money,
I
power,
think,
they
I
have
think
the numbers.
I think we
You
got
see,
your
you,
point.
you see where I'm going then.
Yeah. We really need to, as a
We
community.
need, for example, we're losing Little Haiti because we all left.
Right. I think we got your point, which is that as a community that's been here for 2-3 generations, we need to integrate a bit more, even more, not a bit more, even more. I'm not sure I would agree with the idea that no immigration, but because I mean we have 100,000 brothers and sisters that needed this to be signed, but we'll just leave it at that. And I think the positive side of your point is that we need to be involved in other things, in terms of, focusing on trades that people can really integrate and make a life in the American system. And that point is absolutely one that we can all support and agree on. Dr. G.
Thank you so much. I wanted to say thank you to Dan for his comments and reflections and thoughts and so forth as well. I just wanted to make one point so that people understand. This is not the people who are coming to speak about this topic are not the individuals who created an items pertaining to an agenda. And so I want to reiterate that again. And so while you may hear individual folks talking about the points of the agenda, this is an agenda, a policy agenda that came from the members. It is the product of what people showed up to talk about, right? That bubbled up as a part of policy and said, this is an area that we need to pay attention to. This is an area that we need to think through. These are recommendations associated with it and so on. And so while I also disagree, I don't believe that this issue about, we do have a significant number of young people, I see them, who are also immigrating to this country on a regular basis every single year. So I do think it's important that when as we are here speaking about this particular document, we are not the owner of the content of the document, of the materials in the document, that the owners are the people who showed up as a part of the discussion to really create this agenda. Our goal tonight is just to present what was produced. It could have been anybody else came in to have this conversation. The second thing I'll say, and that is, if we remember this piece, what Leonie said at the beginning of this, it was avancé ensemble. It was the young people who absolutely said, we need to ensure that there is a policy agenda for this community and really work within this larger community to make that happen. So the voice of the young is important. Their perspective is important. And I think it is one that we need to pay attention to. We know very well a whole lot of movement throughout the world happen because when young people get involved. And so I don't want to dismiss that and the importance of the voice in the conversation that we're having tonight.
Let me thank Dan for lumping me in with the young people. Thank you. But I also want to say that fighting for immigration and fighting for economic development are not mutually exclusive propositions. And it is why it really behooves us to have a plan, because what happens usually when you're at the Santla, the farm level, you're dealing with one thing, you're dealing with housing, you're dealing with displacement, and then boom, there's an immigration issue. And because you're a Haitian organization, because you're a Haitian leader, the responsibility falls on your shoulders. So sometimes it's exhausting to have to deal with multiple issues that includes immigration, but we don't have any other option. We don't.
Thank you, Leonie. Thank you. I wanted to give Irwin Sineus. You can unmute Irwin and then ask a question or make a comment.
All right. Yeah, yes, sir. Y'all can see me, so I might as well keep my camera. One is my first question was where's the policy at? Maybe I missed that part, but where do I pull it up at to look at it?
It is, it's in the chat. It's been dropped in the chat a number of times. If you came in late, you may have missed it. So
Okay.
if I can ask one of the members to drop it again, so you'll get
Okay.
that. Second, you had another question.
I appreciate. Yeah, the other, maybe it's more of a reflection. I know you made that distinction in the beginning, so I'm just gonna get to it. Is just because I haven't read the policy yet. So one, respect to all the folks who put that together. I know that in my mind, just as an organizer, I know that sometimes there's systematic things and then there's culture things. So systematically, of course, we have to play the game and as far as what's in the system and what laws are currently there and how we can push for what benefits us. But culturally, as we're talking about all these things, I don't want to forget, like we talk about healthcare. Being Haitian, well, I was born in Brooklyn's first generation, born here. Both my parents are from Haiti, but one of the things I understand about Haitian people is that when I talk about healthcare, we can't forget like our roots and some of the stuff that we have, things that we know about faith, things that we know about certain things. I'm not saying there's not room for modern medicine, but how do we put our money together to create facilities where we could have this type of knowledge being in the forefront of helping our own? When we talk about economic systems, we've had one forever. Things like ISIL. How do we revamp that? How do we create? So I want to talk more about those creative side of things, but I understand, like in my mind, I cipher it as there's culture, tactics, and strategies, and there's systematic ones. This conversation seems to be a systematic one, but I would love to be part of any cultural conversations in the future if we get a chance.
Thank you so much, Erwin. So great to meet you. Follow us on social media. We want to be your friend. A direct, a direct response to that would be for me is that when we talk about cultural competency, we just sometimes make it exclusive to language. And we want our folks who are dealing with Haitian people are in their care to understand the whole gamut. That for sure, we believe in herbs. We're the people of the earth, right? And so how can they also include this in our treatment plans if this is the stuff that we truly believe in? I mean, for all the Haitian kids, I know we've drank tea every day since COVID has happened, in the morning, in the evening. Our parents, I know, negotiate that. And so this is a way where they felt like, we want to make sure that your immune system is healthy, as well as promoting that, we do need to make sure that our blood work is normal, that we get tested, that we go in to make sure that we are safe. And then the second point, you talked about economics. I often like to believe there's so much regulation as it comes to economics. There's so many Haitian young people and even older folks that we know, more seasoned, who are in the finance world, who can't give us any advice around economics. Can you believe that? People who are financial advisors, if you don't have $100,000 or more, can't really give you direct advice. I think that's problematic. We want them to think about the regulations because there are people who have access to knowledge that allows for them in their generation and their people to continue to thrive in a way that, we're still new kids on the block. And so I want us to think about those regulations so that when we do have folks who are in these spaces, who understand investments, who understand crypto, which is a new thing, not sure if we're into it or not, but we want to also better understand how to flip our money, how to make sure that we have a pathway to retirement, not at 80, not at 90, but while we're young and we're still active and we still have a shot at, living our dreams. I'll pause there.
Thank you. And Ludmila, I'm gonna bring you in. I know you had either a comment that you wanted or reaction to something. I want to tell folks, this is the space, this is the time that we have. Did I? Oh, okay, I'm still here. This is the time that we have to have a conversation. If you have questions, please don't hesitate. Questions, comment, reaction, all of it are welcome. So we appreciate you commenting. I'm gonna come to you, Ms. Lacroix, but go ahead, Ludmila.
Yes, so thanks for that. Thanks for remembering me, Johnny. So my comment was going to be related to economic development, but really highlighting, again, how all of these different issues are interrelated. So when we're talking about workforce development and having trainings, apprenticeships, language programs so workers can learn English, that goes back to immigration. Parce que sou pa gen papier ou pa ka aplike. So making sure that we understand that all of these things are interconnected and removing the barriers to some of these services. And sometimes the system or the public services and institutions might already have, let's say, Social Security available or Medicaid available, and people qualify, but because they don't have the appropriate documentation, or they don't have all of their kind of like papers in order to really draw down those funds or draw down and engage on those public benefits. I wanted to reiterate how economic development is going to touch all of the other issues, and how really thinking about the bureaucratic piece of it, as well as the immigration piece, being barriers to access, which is what Sandra alluded to when it came to all of the regulations that are kind of keeping us out of the game of some of these ways to build wealth.
Thank you. Thank you so much, Rutmila. My glasses, my God, my eyesight is gone, but I see La Croix very well. Galiani?
Yes, good evening, everyone.
And I apologize if I butcher your name. It's my bad eyesight.
That's good. That's good enough. Yeah. Good evening, everyone. And I am behind the camera. Okay. I'm sorry. And I really appreciate being with you guys tonight. And a big thank you to Central who sent me the email. Yeah. And I was following you since you start at 7. I was there and listening to you. And first of all, I want to say congratulations for you guys to put that together. That's a big job. And like, pat your back and say congratulations to you. I really appreciate it. Yeah, it is good. It is really good. And when Central said about talking about the health, or the saving for retirement, I can tell you, I am a retirement specialist. You see, I bet you problem of this. I work for the school system. It is so sad. And I say sad, it is so sad to see. I'm talking about professionals. I'm not talking about Haitian. I'm not parler de Haiti. I'm parler professional teachers, school counselors, working for the school system for 30 years, qui pa même ka sorti dans système non parce que yo pa comprendre système. They don't even understand. They get the job at 24 or 26, graduate college and get a job as a teacher, and they work for like Broward School Board or Miami-Dade County School Board, West Palm Beach. They never one day open the contract they have with the school system and read it to understand the benefits were there for them. We have a lot of work to do, guys. We have a lot of work. Moi-même, personnellement, je travaille plus, je travaille Orlando, Orange County School Board. I work in Port St. Lucie, Fort Pierce, and a little bit in Broward, but vraiment, travail, moi, c'est dans deux côtés ça. I'm trying to get to Miami. Je travaille à Miami for 14 years, je travaille à Miami. But what I see, gade l'aime trembler. L'aime trembler devant de professionnels qui pas même lire un contrat que le gagne as a professional for all that long. I'm talking about 20-something years. Et puis, l'aime pas retired, moun qui comprennent le système, la sorti à 200, 300, 400 000 $. Et puis, pour l'autre monde qui sorti à 150 000 $ ou bien 100 000 $. Guys, we really have job to do.
Yeah.
We really have job to do. Thank you so very much.
Thank you.
I got a moment to say that.
Thank you,
Yeah.
I appreciate it. I appreciate it.
Yeah.
Gilbert, you wanted to say something? Gilbert Saint-Jean?
Sure, but I would request to go first to Cornelie Antonio.
Cornelie. Oh, I'm sorry, Cornelie. Yes. Oh, thank you. Thank you, Gilbert.
Yep, come back to me. Yep.
Hi, thank you, Gilbert. I appreciate it. Greetings, everyone. My name is Cornelie Antonor. I am a Miami native, and
You went on mute, Cornelia.
You went on mute.
That's
Yeah.
crazy. Sorry. I'm sorry. I'm downstairs at work. There's no signal upstairs, so that's why I'm down here. I apologize. But so I've attended. I'm sorry.
No, go ahead. Go ahead.
I've attended several of these Haitian diaspora meetings since I was like probably 8 or 9, probably like since I was a kid in elementary school. And it's always great information, always all of this talk and this policy and that policy and what TPS did and what it didn't do, et cetera, et cetera, et cetera. But for somebody like me that's definitely not in politics, doesn't understand politics, won't get into politics because that's not what I studied in college. So what is it that people like me that has nothing to do with politics or truly can understand politics, what can we do? What's the work that we need to do in order to be of better benefit to this to all of everything that's going on, right? Because I heard Santra, I believe Santra, great information today. Johnny, you came in first and you gave us your introduction. It was great. Gilbert said some great things, and Dr. Gelda and Leonie, great information. But I'm not into politics. I don't know nothing about politics. That's not my realm. So what can somebody like me that's 24 years old, what do I do? What can I do to make or help you get the word out or spread the word? Or what can I do in order to help our community to get to the level of where what I like to call them the blancs is? We were talking about finances. I definitely want to understand when I can retire, how soon I can retire. So the only way that can happen is if there's a conversation back to these folks that don't know much about everything that's going on. Hey, if you do this, or if you're doing that, or if you're helping us, I need the connection. And there needs so what I'm trying to say is there needs to be a bridge, and there's no bridge to building the gap or
Thank
whatever.
you. That's fantastic. Thank you so much, Cornelia. Thank you. Who wants to take that?
I'm dying.
Yeah, I realize you're just about to jump out of your
Before you
chair.
grab her, you can become a Sutla Fellow. Go to our website. That's absolutely a great link. We have a leadership program, and Santra and Ludmilla are all graduates of our fellow program. And so you will definitely, we don't talk about politics, but you will have to understand the impact of politics in the history of our community and in its trajectory. So definitely encourage you to become a Sutla Fellow.
I would definitely echo Leonie's point. I would definitely highly recommend you become a fellow. I want to make a differentiation for you. There are people who will be politicians, right? There'll be folks who run for office, and that's not for everyone, right? And then there are people, everyday people, who understand there's not a part of life that is not impacted by policy and politics, right? The air that we breathe, the food that we eat. There are countries who some of the food that we eat here, they will never sell those in other countries because it's poison to our bodies. And so I think Haitian-American really wants to connect those dots for folks. Everybody's not going to run for office, but we definitely want people to always vote. We want people to tell their community members to vote. In terms of investments and wealth building, Haitian-American wants to talk specifically about estate planning with our communities. And not only that, what does it mean to take care of aging parents, right? That's a whole situation that is coming upon us. And a lot of us haven't begun to have those dialogues. And so I hope this answers your questions in terms of things that you can get connected to. Connect to St. Lau with their fellows program. Connect to Haitian-American. We're on all of your social medias, and we do lots of trainings, lots of discussions, trying to connect people to resources and connecting the dots for people. And then last 2 points really quickly, just because you're young. I wish I was you at 24. I was not that. 2 points. We had a wealth advisor tell us 2 things. Make sure you have your savings on point. Make sure you have your healthcare surrogate, all that stuff. So before even investments, really quick next steps is, do you have 3 to 6 months? We just went through a year of a pandemic. So now you might need a year of savings. And then also, do you have your paperwork in place? And I'll pause there.
Thank you. Thank you. I don't know if we have other, I know Gilbert, you wanted to add a comment. We'll take yours and then we will go to Dr. Gerda to really bring it home for us and really help us think about what the next steps are for this in this from this conversation. Gilbert?
Thanks, Johnny. So my involvement in the development of this policy agenda paper as a board member of Abassin Assam came from an interest of just growing up in the community, born and raised here in the US, families from Haiti. Obviously, I'm an American, right? I have American ways and whatnot. But that those Haitian roots nonetheless, influence me one way or the other, to the point where I'm part of this discussion we're having here tonight. And so with that said, a number of us are doing fine, doing great and whatnot. But nonetheless, you look back at the community in general and you say to yourself, we've made great strides, we have a ways to go nonetheless. So how do we get there, right? And so being here in America, what are the steps, what are the discussions, what are the conversations that we need to have throughout the system, whether private sector, public sector, so that we can lessen things such as what's called with our resiliency, but nonetheless, we have something that's called, and it's been documented in other immigrant communities, right? Called the immigrant's paradox, in which the first generation of people who come to the US, despite the various distractions and whatnot that prevent them from reaching their full potential, nonetheless, statistically speaking, metric speaking, outdo, right, the communities that have been here for any number of generations, right? Who are, people call them, more or less American for the most part. There's no hyphen or whatnot. That's included. Because that first generation knows that they have to do what it takes to achieve, right? But then the successive generations, right? The children like ourselves and whatnot, and our children and so on, take step, actually, statistically speaking, on a number of cases, actually take a step back. So that progression, right, that positive growth trend, right, that was being experienced with the forebear generation slows down and sometimes even reverses. So we've had a pandemic that's hit us hard, right? We had racial justice unrest, right, last summer. That makes us all have a reflection, and the country's going through a reckoning, still trying to figure out, okay, what's next? So with this decade that's coming up, the importance of a document like this, it's not the end all be all. It's a living document, right? It's something in which it's a conversation starter, which is great that we're having this conversation tonight. And with that said, nonetheless, we need to further discuss more and more what it is that we need to do, right, to keep that positive growth trend to continue. Let's try to slow down and even reverse what we've taken one step forward or maybe two steps forward, but we're taking 2-3 steps back. So keep that in mind as we're doing that. And one more thing that we forgot to mention, well, not forgot to mention, but we didn't come up is, if you're talking about like in Miami-Dade, the Northeast Corridor, in Broward County, in Palm Beach, like Pompano Beach and whatnot, we need to start having a discussion, not looking on the sidelines when it comes to things like affordable housing, workforce housing, okay? Already on average, we're poor. On average, we're poorer than the general community around us. Guess what? Nonetheless, we have our enclaves, right? Where Haitians are the majority population in a number of cases. Some of us, that's not the case. Like I said, doing great, fascinating, and whatnot. But nonetheless, we have our majority enclaves. And with that said, your higher income neighborhoods, right? Their rent levels, their home price levels are actually kind of leveled off. Whereas the quote unquote poor neighborhoods, right, where a lot of the Haitians collect, right, their rent prices, their housing prices doubled, tripled, right? And so that whole thing about stability and just included in that fundamental that's keeping a roof over your head, right? And so when it comes to affordable housing, workforce housing and whatnot, since we're essential members of this community, integral members of this community, we need to have a loud voice, an engaged voice when it comes to how are we addressing the issue of affordable housing, okay?
Right.
we move out of neighborhoods and whatnot. We even move out the state because we just been priced out in a number of cases. And so that discussion that we need to have when it comes to issues like gentrification and whatnot, that's great. If your home value doubles, triples, love it, right? That's a great benefit. But nonetheless, how do we make sure that the communities that we've been in for 20, 30 years, we want to continue to stay in them, that we're able to stay in them? And that includes just keeping a basic roof over our heads. How do we address that? It's all interconnected. So we need to have that discussion too.
Great, great. I was trying to look through while you were talking through Facebook, and I see that Gilbert Crispin had asked a question, and I think, and this will be the last question before we turn to Dr. G so we could close on time. Do we really not have anywhere to go, or are there significant logistical challenges and barriers that we should face, rather than that we wouldn't contend with? So do we just resign ourselves to remaining here? I think maybe Gilbert is talking about some of the conversation we had before, and he's asking whether, you know, the community has to stay here, or do we have other places to go, or can we move?
Gilbert prend l'autre côté. Gilbert vle konnen nan ki l'autre pays, est-ce que gon l'autre côté, gon l'autre planète, where else can he go? Why does the United States have to be the only place? Are there other options and so forth? But I think that's a larger sentiment, right? That is a larger sentiment about, it's about how one is feeling in this particular space that we are in, that oftentimes when we are not valued, right? And in that sense of not being valued and questioning whether or not, is this home? You know, is this home, right? You know, for one. And I think that's an important question. You know, it's an important question that should be on the table. We see very much, because as I said with George Floyd, that this is we are seeing more and more and understanding more and more the issues, the structural issues that exist in this particular United States as well, right? And we haven't really talked about these things, you know, absolutely. I do anti-racism work, and it's like, feels always like the dirty word whenever I show up to have the conversation about that. And so I do think it is an important area and that Chris is mentioning, that worthy to mention. I know we're running out of time. We want to be respectful of people's time, and I want to just say a few words before we conclude, and that is, what we're presenting today is just a starting point, right? And it's not the all and be all. I want to be clear on that. And so we don't come here and assume that this particular agenda is it. It is perfect. It has everything that it needs to have in there, right? And all the various components and so forth. It is a product that was created, that was produced out of conversations with larger folks in the community. And I do think it served as a good example for so what we should be engaging in, the conversations that we should be engaging in our communities, right? It is Haitian Heritage Month. And during Haitian Heritage Month, yes, we compas, yes, we celebrate the flag, yes, we do our dance, but we should also take this time to also think strategically. Where are we going? Where have we been? What should be our plan, right? And we do believe on this side here in South Florida that having a town hall to have these conversations are key. So we're inviting all of you to take a look at the Haitian-American policy agenda that was created out of here at South Florida. Look at it, dissect it, you know, deconstruct it, criticize it, have your comments, say, you know, whatever you think is there as well. But we're also encouraging that no matter where you are, whether or not you're in Boston, whether or not you are in, you know, in New York, whether or not you're in Atlanta, that we also are looking at how do we create spaces for having these conversations that are related to policies around the country in which we are in that have implications for where we came from, right? As well, that we make sure that we are creating similar documents. So maybe, just maybe, if all of those places, states that Johnny mentioned at the beginning of all of this, and each one of us are meeting to talk about what is important within the community, and it turns out that education, health, housing, immigration is what New York is saying, is what Massachusetts is saying. Maybe that allows us to think of, maybe we have a national policy agenda, that when we're talking to our senators, when we're talking about the person who's running for president of this country, then we are showing up with this larger point as well. So we are clear that we must, what we're saying today is we must have a plan. We need to have a plan in order for us to know how we're moving forward. It cannot just be emotional. It cannot be that we are reacting because we having a need to react, but that we have a document that we can present to our elected officials, to the people who want our vote, to say, here is what's important to us. Where are you in these particular areas? So again, this is not we don't want you to leave here thinking that this is the perfect thing. We're asking everybody to take this and make it their own. We're saying, we are happy to share with you our process here, but we're hoping that you're going to develop your process in where you are as well. And maybe we can have a national, meeting, maybe a national town hall where we're talking about what is the Haitian-American agenda here as well. This is an ongoing process. This is not a one-timer. You know how we have those one-hit wonders? So, okay, this is cannot be a one-hit wonder where it is a one-time, we come together and we do this and that's it, and it sits on the shelf. Because we are a moving target. Lots of things are constantly changing. So we need to be en courant, right, as well, to ensure that what we are producing is reflective of the community in which we are in. The last thing I'll say is we cannot create something that becomes a showpiece. This is not an art piece. It cannot be something that sits on a shelf that we can say we have produced this document and we can show it, but that we're not actively thinking about how we are operationalizing, how we are concretizing it, right? Who are the holders of all of that as well? So while we're looking at these areas of the agenda, we're looking to see the organizations for whom should be the holder, should be the owner of those particular areas, so that we can stay within our lanes. C'est pas bagay nous fait tout temps, oui, parce que nous pensons nous capable parler de toute bagay. Moi-même son psychologue, moi rete dans ligne psychologue, I'm a psychologist. I stay within that line of what I can produce. So when my dear sister says I'm not a politician, and therefore then I appreciated that comment, because it means that there are people who are more political savvy than myself or her that can have these conversations with the politicians in some ways. So part of this process is about taking a look at the component of this agenda and said, what's yours? Where are you? Giving your expertise, giving your organization's expertise, how do you connect? How do you become an owner of this so that it can become an ongoing living document that we can, continue to work on? And so all we're saying is the work needs to be done. The work it's ongoing, but we got to go somewhere, people. This bus has to go, because the other buses are leaving. The other buses they're gone. And we need to start making sure that we have a plan, and we're just starting this process here. And we invite all of you to join in that journey as well. So thank you. And I want to say a special thank you to Johnny for joining us this evening, because without Johnny's excellent moderation, we could have all gone off on lots of different tangents and not necessarily stay focused, Johnny. We want to say a special thank you to you. And of course, everybody who's came on this Zoom and everybody who's watching on Facebook as well. So thank you, Johnny.
Thank you. And before I close, I'll just take 30 seconds, but a question. I know that the agenda is on Facebook. How else can folks get it? And if they have questions or they want to reach out, how does that happen?
I hope we're in the process of many of the partner organizations adding it to their websites. Avancé Ensemble has already done that. Definitely Santla, who was a lead partner. Hopefully it'll be on their website as well. You can check it out on Avancé Ensemble's website. HAPC, who's on the place, HAPC, who was an organization who also gave input. I see some of the nurses, Hannah, Hakoff. There are so many partners who we know that it might just take them some time, but it'll be on their website as well. It's already on Avancé Ensemble's website. And we will definitely send an email to everyone who participated if you registered, because that's how we have your emails, with the policy agenda attached as well, to make sure that you all have it. And then I'll just take one more minute to recognize just a few people. Elizabeth Owens from Commissioner Monestein's office, thank you so much for joining us. Gerlene Joseph from San Diego, who's been holding down the front lines at the southern border. Chapeau, Bob, my sister, thank you for your fight. And then I know I saw Matthew Beatty from Carrie Meek Foundation. I think he had to jump off, but everyone is super important. And to my colleagues, I would be remiss, Gilbert, Ludmilla, Gilbert, when I was over it, you got us there. So I would be remiss not to say that publicly. Thank y'all so much. And thank you to the leadership.
I just want to recognize Dr. Marcelin, who's here, Dr. Ernst Marcelin, who is an incredible researcher on all things Haitian. He's done seminal work on youth. So I really want to recognize Dr. Marcelin. And please, Gilbert, forgive me, but I also want to recognize your father, Dr. Gilbert Saint-Jean, who he passed away, but he was one of the first public health people who did a door-to-door health survey, the first one ever of Little Haiti. So, it shows you that even there's change in continuity, and you are definitely, it always touches my heart to see you because I remember your dad. So I just wanted to say that also.
Léonie, beaucoup là, là, comme si elle était là depuis j'hésitais, petit garçon.
C'est pour ça, that's why I love Dan. I love Dan. Dan a parlé de jeune monde. And, I also want to recognize Gypsy Metellus, who held down the fort and continued to have this conversation since 2014, 2020. She drove the process of this community agenda. So I also want to recognize her tonight.
Great. Well, I'll just recognize very broadly all of you in Florida and Miami in particular, because I think in many ways you have been in the vanguard of a lot of things for this community. And I know for us here in New York, at least for me, I look towards what Miami's doing and say, what can we do here in New York to reflect that? So in as much as sometimes it may seem like you could be further, you could do more, just understand that you're really leading us in many ways. And so thank you for that. Thank you for this entire group here who worked on this. Santra, Dr. G, Leonie, Ludmilla, Gilbert. It was really great to have you on the panel. Thank you for respecting the time. Thank you all of you who participated. This is, as the group says, the first, but it's not the last. Hopefully not only not the last for Florida, but not the last for all of us who are here in the United States. And why not go to Europe and Africa and other places and really have a Haitian agenda? So with that, I say thank you. Please stay healthy, take care of yourself, take care of your mental health, take care of your body, stay healthy. Thank you so much and have a good night.
Thank you all.
Good night all. Merci bien. Bonsoir.
Bonsoir.